Now, let's get some reaction from the Republican side of the aisle. Senator Lamar Alexander is the #3 Republican in the U.S. Senate. He's the Republican from Tennessee. You had a fascinating exchange with the president at Blair House last week. Senator, give me your quick reaction. Did he convince you?
It's very disappointing. I mean, we spent 7.5 hours talking about ways that we could set cutting costs as our goal. I mean, that's the real way to get your health insurance premiums down and to keep the government from going broke. And the president's basically saying, even though the American people have tried to say in every way they know how, they don't want this bill. The CNN poll showed only a quarter of the American people support this bill. The president says, we don't care. We're going straight ahead. We're going to pass it anyway. We're going to jam it through with a partisan vote.
Well, he says it already passed the Senate with a supermajority of 60 votes, already passed the House with a majority. You don't need supermajorities in the House of Representatives. Now to make a few minor changes, or relatively minor changes, he says, go ahead with an up and down vote in the Senate. What's wrong with that, since Republicans have done that on many occasions as well?
Well, the first thing wrong, Wolf, it's not the Senate here, it's the House. What most people are focusing on the Senate, but the House is going to vote. And what he's basically asking the House Democrats to do is to join hands, jump off a cliff, and hope Harry Reid catches them. And Harry Reid's going to have no incentive to catch them, because as soon as the House passes this bill, it goes to the president will sign it, it's law, and then it goes to the Senate to see if the Senate can fix the Cornhusker kickback, can fix this, can fix that, can fix the abortion language, and there's no guarantee that'll happen.
Well, my understanding, Senator, is that it would come up for an up or down vote in the House of Representatives, the Senate version, the version that passed with 60 votes in the Senate. Right. But then the House would vote immediately after that on some changes to that Senate version, an up and down vote, and then those changes go back to the Senate for an up and down vote.
No, that's wrong. They're going to send it right to the president. They're going to split it. They're going to send the big bill, the bill the Senate passed on Christmas Eve that was written in secret and voted on at 1 a.m. As soon as it passes the House, it goes right down to the White House. The president signs it, and then they send the reconciliation part over to the Senate, and we get to decide whether to make the changes. So it's up to the Democratic House members.
The House has to vote on what's called the reconciliation changes right away. That's part of the deal that Nancy Pelosi will have with those in the House, the Democrats who don't like the Senate version.
No, that's true. They will have to vote on it. But what I'm saying is that the spotlight should be on the House vote, because once the House passes it, it will go to the president and it will become law, regardless of what the Senate does.
Ali Velshi has a question for you, Senator Alexander. Go ahead, Ali.
Senator, last week at the healthcare summit, you and the president got into it a little bit about those Americans who are insured, whether under this proposal their premiums are going to go up or go down. You said they were going up. The president said they were going down. This went back and forth a few times. Subsequently, I imagine you've been digging into this a little more. Again, the president said today which this cost-cutting measure mirrors the proposals in the current Senate bill, which reduces most people's premiums and brings down our deficit. Do you agree with that?
Well, what I said the other day was absolutely accurate. I said for millions of Americans, individual premiums will go up because of government mandates and taxes. And that's precisely what the Congressional Budget Office, that the president likes to cite, said on November 30th. It's true that some people will get subsidies, but the rest of the people won't. And to give you an example, Senator Susan Collins in Maine said because of the government mandates in this bill, 87% of the people who have individual policies in Maine today will pay more under the president's bill. Give half of them subsidies, which taxpayers pay for, and still 30 or 40% are paying more for their individual policies. So what people need to understand is this will raise their taxes, cut Medicare without putting the money into Medicare for millions, raise premiums. It will raise the deficit because they're not counting doctors, paying doctors who serve Medicare patients. And that's like having a horse race without a horse. So that raises the deficit. Then they're sending a lot more to the states to pay. Well, that'll raise tuitions and taxes. So the more people get into this, they'll see it's the same old model that we rejected in December, and that's why 25% of the people in the CNN poll say we like it, and 75% say stop or start over.
How do you respond, Senator Alexander, to the president's assertion that the Democrats' plan will bring in an additional 31 million, largely middle-class families, into the insurance programs that are out there. The Republican alternative would only add 3 million families, individuals, to the insurance program.
That is true, and we can't afford it. And that's the reason that we have a $500 billion in new taxes. That's the reason we're taking a $500 billion out of Medicare, which is going broke by 2015. That's the reason all the governors are up in arms because of the unfunded mandates. And half of the people who the president plans to insure under his plan will be dumped into Medicaid, a government program. Half the doctors won't see Medicaid patients, so it's like giving people a ticket to a bus line without a bus. It's not real health care reform.
Senator Alexander, thanks very much for joining us.
Thank you for your time.